Hey, what's up guys? Dr. Tim Pavlak here. I'm a physical therapist. I'm the owner of Physio, Orthopedics, and Performance. We are here inside of Cuyahoga Falls CrossFit, and this is DPTRX. Today's episode we'll cover the low back tweak, something that can happen to anyone. A lot of times it's from not warming up, not having the mobility you need to assume a certain position, such as a squat or a deadlift. Usually what you're doing is you're about to pull, you tense up, you feel something tweak in your back, and you're usually down in pain. A lot of times this can take people out of commission and allow you not to be able to work out and do what you want to do for a couple days or a week even. The worst thing you can do is nothing. The worst thing you can do is be in bed and take medication. What you need to do is you need to address the mobility, you need to address the problems. 3-step solution to kind of get you on your way. Obviously, I've had people in here with low back tweaks. We've been able to get them better in 15 to 20 minutes, get them 80% better, get them from a 9 out of 10 pain to a 2 out of 10 pain and back to doing what they care about. But things you can work on alone and by yourself. Step number 1 is heating up the tissue. So a lot of times tissue in spasm, if you apply heat to it for about 10 minutes, obviously if you have any sensory deficits then you need to not be doing this. But if you have normal sensation then you should be able to tell what you can tolerate. Have a couple towels maybe underneath your back as well to make sure you don't burn yourself. The heat's going to relax those tent muscles because basically there are 2 problems going on. There's a joint problem where the spine has been sprained, and then there's a muscle problem where the muscles that surround the spine, the paraspinals, have been strained. So a sprain and a strain on top of each other is what we're running into. So heating for about 10 minutes to initially kind of run through the situation to start to progress you, get away from that pain. Number 2 is addressing the soft tissue. That's the muscles. I'm going to show you an exercise to address a soft tissue mobilization. Number 3 is a facet joint mobilization, so going to the spine itself, where sometimes a hypermobility or the spine is not moving, the spine's a bunch of different segments stacked on top of each other, and you need to have mobility at each single segment. So addressing heat initially to loosen up the tissue, to bring new blood flow to the area with new growth factors and healing factors, and kind of reset the healing process. Number 2, soft tissue mobilization, and 3, addressing the spine itself. We're going to run through number 2 and 3 here in a second. Alright guys, so actually we've had that heat on for about 10 minutes. You're going to run through steps 2 and 3. Number 2 is a soft tissue mobilization. You're going to be on the floor, not on a bench like this, but on the floor with a couch towards your feet. What you're going to do is you're going to put your feet up on that couch. What it's going to do is going to get your back flat. A lot of times if you bridge initially, lift your feet off the ground, put your spine in neutral and hips in neutral, and then there should be a couch right here. Lacrosse ball. Roll to one side, find the area that's tender, and roll back. You're going to be right, not on the spine, but right next to the spine where those 2 muscles run along those sides, on both sides of your spine. Find there it's tight, your feet are up, you're taking deep breaths in and out and letting yourself relax as much as possible. You're going to do this for about 2 minutes. Hit those 2 minutes, move on to the next exercise, which are point number 3, addressing the spine itself, facet joint mobilization. Exercise number 1, you are on your stomach, on the floor, your hands are at the side, right next to you, arching your chin, arching your back up to the sky. 1, 2, and back down. And you're going to go back in that, you run through that 10 times. Number 3, step 2, back on your back. Feet are out the side, your shoulder blades are flat on the ground. Your shoulder blades should not come off the ground. You're going to let your hips fall to the side, keeping your shoulder blades on the ground. You're going to hold for 2 seconds, 2 count, 1, 2. You're going to rotate back to the other side, same thing, 1, 2. You're going to roll through that 10 times each side. After you do that, stand up, do a little self-assessment, move around a little bit, see how you're feeling, and you may have to go through and run through these again. Heat first, soft tissue mobilization, spine mobilization. This is DPTRX. I'm Dr. Tim Pavlak, and I hope to see you in the clinic soon. You can check us out at physio-orthoperform.com. That's physio, P-H-Y-S-I-O, orthoperform.com. I'll see you guys soon.